Hi, in this video, I'll be talking about getting a tattoo during breast cancer and its treatment. I'll talk about two types of tattoo. One, nipple tattooing, and the other, body art. And then sort of the intersection between the both. So when somebody's had a mastectomy and they choose to have a nipple reconstruction, which is something many people are surprised with how much they appreciate having had it done, there is tattooing of the area to create a new nipple. So the nipple itself is constructed as a discrete raised part of the reconstructed breast, and then the area around the nipple, the areola, is tattooed to resemble as much as possible a normal nipple. A lot of people think this is going to hurt, and because it's in a newly operated on reconstructed breast, they're surprised to find that it doesn't hurt as much as they expected. Your plastic surgery team will work with a tattoo artist who is accustomed to and is an expert in nipple tattooing. This can really be done at any point during your treatment course. If the reconstructed breast will be getting radiation therapy, which is fairly uncommon, radiation usually precedes reconstruction, it's probably best to wait until after radiation therapy is over because the skin can be really tender. And although it doesn't necessarily hurt, it's probably best not to do tattooing when there might be some skin breakdown or redness because of the radiation therapy. But really, even if one is on chemotherapy and it's time to get tattooing of the nipple, you can proceed. Nipple tattooing done with sterile conditions does not increase your risk of infection. Now, you may wish to wait until chemotherapy is over and the sensation won't be back. So waiting until you're done with chemotherapy will not increase the discomfort associated with nipple tattooing. Then there's body art tattooing. It's not uncommon after we go through something traumatic to want to mark the body in a way that's elective, right? You're having surgery you never really wanted to have, or maybe you did, but it's cancer focused. What if you want to get a tattoo and you always have and now feels like the right time to do it? It's something you want to do to bond with a friend or a family member. You can have body art tattooing done even when you're on chemotherapy. The only reason to wait is because what you decide to get as your tattoo may change as you go through the process. So marking the body with body art is a form of body reclamation after trauma. We see body reclamation with all kinds of things that people go through, and breast cancer, any cancer, and its treatment is one such event that people sometimes wish to mark that they've triumphed over it, that they've been strong through it, and all kinds of things might appeal to you as a way to celebrate yourself, your resources, your resilience, and to mark what you've been through and come out the other side with. So I've covered nipple tattooing and also body art tattooing. What if you want to get body art for your nipple tattoo? So instead of the typical tattooing that resembles a nipple and areola, what if you want to do something different on your nipple? You can do that, and it's very likely that the same tattoo artist who is going to do your nipple tattooing with the more standard, let's make this resemble a normal nipple, could also do something like a flower or a petal, a fern. And I've had quite a few people decide to do something like that, something a little more unusual. I've covered a lot in this video. I've talked about nipple reconstruction and tattooing, body art and what it might mean to you and why you might do it, some of the issues around timing and how it should be done, and also something a little unusual if you were to have your nipple tattooed as part of reconstruction. I hope this has been helpful to you. If it has, click like because that helps other people who have the same questions find this video. And if you hit subscribe, that will help you find other videos that we create, and we're always putting out new content on this channel. If you have a question or a comment, drop it below. We try to get back to you within a week to 10 days. Follow us on Instagram. We just kicked off our Instagram channel. And as always, you can visit yerbba.com to learn more about your treatment options and get your personalized report.